Atika Amin. Today I'll be talking about using social media to mitigate health impact of child abuse in developing nations. A little bit about me. I'm a high school senior from Bangladesh, passionate about science Olympiads. I was in the KLES program in the US last year, and I plan to major in STEM in college. So what is child abuse? According to World Health Organization, all forms of physical and emotional ill treatment, sexual abuse, neglect, and exploitation that results in actual or potential harm to the child's health, development, or dignity is called child abuse. So these are the 4 types of child abuse: physical, emotional, sexual, and neglect. And the health issues caused by child abuse are physical injuries, post-traumatic stress disorder, and other mental health illnesses, sexually transmitted diseases, etc. So why should we care? Because nearly 3 in 4 children aged 2 to 4 years suffer physical punishment or psychological violence at the hands of parents and caregivers. So there's a huge gap in public awareness, even amongst the parents and caregivers. Another study says 1 in 5 women and 1 in 13 men report having been sexually abused as a child aged 0 to 17 years. A recent estimate from WHO shows that 40 million children aged 0 to 14 years are abused, neglected, and require health and social care. These studies show how prevalent child abuse actually is everywhere in the world, and how most of the children who are abused don't get the necessary health treatment that is required for them to recover from the traumatic child abuse. And the situation is even more extreme in developing countries. Let's look at the scenario of Bangladesh, for instance. Most of the cases are not recorded due to taboo, overpopulation, illiteracy, and unawareness. There is limited preservation of child rights, which means that children are often deprived of education and health treatment. There is also lenient legal actions and social justice against abusers. So that means that the abusers can walk around in public without any shame or consequences, whereas the victims are the ones who have to hide away and face disruption in their daily activities. There are also social practices like child marriage, child labor, child trafficking. These are the factors that only contribute to worsen the situation. There is also little to no medical resources available, especially there is almost non-existent mental health care. So how can social media help? Social media can help reach 77.36 million users in Bangladesh. It can also educate people, create dialogue, reassure the survivors of child abuse, spread correct information about it, and break the social stigma around child abuse. So while I was researching, I came across this approach. There's Pratibadi, a web and mobile phone-based application designed to report, map, or share women's stories about sexual harassment in public places in Bangladesh, which had notable success. So even though sexual harassment and child abuse are both socially stigmatized issues, there was no such approach taken against child abuse. Also, children don't often recognize abuse right away to talk about it, and parents are often unaware. So this approach is not going to work. Also, the few non-profit organizations that we have working against child abuse only interact through English and do not have posts relatable to average Bangladeshis. So they do not reach the general mass population of Bangladesh. So what we did to change the situation? Me and my friends just decided to found Rebound Against Child Abuse. We're mostly active in our Facebook page, where we share informative posts about child abuse in our native language, Bangla, share stories of survivors, create awareness about mental health issues, because mental health issues in children are often a topic not talked about enough, because people think that only adults can help mental health issues. And so we think it's important. And then we create public opinion, provide an anonymous and safe space for child abuse victims to talk about it. So this is our motto: protection, freedom, care. What our posts look like? So this is one of a recent Facebook posts. My friend actually illustrated this picture that you are seeing. And I looked up the information and one of my friends made the entire poster. So this poster highlights the ways adults can come forward to help the children struggling with mental health issues in our society. So all of our social media activities include creativity, research, and team effort. What more can be done? We want to make sure our posts are engaging, reliable, and up to date to ensure the most public reach. We also want to reach out to professional therapists and organize online free therapy sessions for the victims with mental health struggles who need the immediate help. We can also collaborate with child advocates and health professionals to hold educational and interactive online live sessions. But these are all our future goals, and we're working towards it. Other research papers that validate our approach. As the study suggests, a digital space, safe space can be crucial to create a support system for vulnerable population like child abuse victims, which is exactly what we intend to do with our Facebook page, to create a judgment-free space for child abuse victims to talk about their experience. Also, as this study suggests, community-driven approaches like social media pages can be a significant way to foster a sense of belonging. We wanted to let the victims of child abuse know that they are not alone and that we can all fight this together. So what you can do to help? As we saw from the studies before, social media can make a huge difference. So that is why I urge you all to use it as the powerful tool it is. To fight against a global health issue like child abuse, which is often something that we don't talk about enough, we need all of your voice, dedication, and engagement. Let's use our voices on social media to speak out against child abuse whenever we can and let people know its harmful health effects. Respond, because you can change a child's life for good. Here are my references. I want to thank the Global Health Leaders Conference organizers for giving me a chance to talk about a global health issue that I deeply care about. I want to thank Rebound community for always supporting my ideas. I want to thank my family and friends for always believing in me. And I want to thank you, the audience, for listening to me this far. Thank you again. If you have any questions, you can contact me in my Gmail account, LinkedIn, or Instagram. Thank you for listening.